real briefly, I want to talk real briefly about housing as a basic need. And so I like to kind of review homelessness in general, and how we kind of got to where we are. Because if we look back at history, what we find is that we're really kind of repeating a cycle. So just real briefly, after World War I, there was a massive amount of homelessness, and they were called Hoovervilles at that time. So you found these large encampments near the edges of towns, close to water. And so they were very, very prolific. And there was large marches. Veterans were disproportionately represented. So you had these large marches to DC, and you had massive encampments set up outside of DC. And so ultimately the government's response to this was using the military to clear these encampments. So really kind of a police action to do that. We had no social supports in place for this population. We really had no plan on how to address that and deal with it. So through that, though, you did start seeing some emergence of this. So you start to see the first public housing in 1937, and then they opened what they called transit centers, which were places to try and deal with this homeless population. And so you saw a lot of images that kind of look like this, migrant farmers, and then this is in New York City. And so, you kind of look at the shacks that are built. It's basically out of garbage, things that they find at the dumps and what have you. So it became very, very prolific and a huge issue for the country. You had no sanitation, you had a lot of disease, all kinds of issues associated with it. A lot of things went into that. So World War I was a big component of it. So you had all these veterans coming back. They didn't have jobs. A lot of migrant farm workers, industrialization. So we didn't have supply chains. We didn't have on-demand products and what have you. So manufacturers would produce a huge amount of good and then just fire all their workforce. And so you'd have these large-scale layoffs. And we really had no social policy to manage this or deal with it. So how did we start to get out of it? Really, it was World War II that started to bring us out of that. So you had the mobilization of the economy, but you did start to see the development of public housing. So this is when we start seeing that. So just to put in perspective, in 1961, we had 40,000 units of housing, and 11 years later, we jumped up to 436,000 units of housing. And so we also had a prolific economy. So you had low unemployment, and so people were able to kind of prosper, and you really started to see the Hoovervilles disappeared, and you start to see more an end to homelessness. So we don't really see homelessness again as a country until the 80s. And so in the 80s, you saw a pretty significant change toward public policy. And it really started with Ronald Reagan. So he, deinstitutionalized the hospital. So you had thousands of mentally ill patients that went into the community. Some did well, many did not. Another huge piece that isn't talked about very much is HUD, or the low-income housing assistance, was cut from $32 billion in 1981 to $7.5 billion in 88. So as you're seeing this increase of people needing more resources and more care, you're actually seeing decreases in social spending and what have you. Again, we started to see encampments, not large like the Hoovervilles, but you started to see fairly large encampments around New York City and some areas around that. And again, our response as a country was to send in police and riot gear. So it becomes a police action when we, encounter individuals that are homeless. And so you also start to see a lot of laws being created around panhandling and loitering and urinating in public and those types of things that basically makes it illegal to be homeless. So this is kind of a couple pictures here from during that time period in the 90s where you started to see that proliferating. So again, that's just a super, super brief history of homelessness. And if you start to compare it to what we're seeing in today's world, if you go out to many large cities, especially West Coast cities, you see these massive, massive homeless encampments. And, LA has more than 10,000 individuals that are living homeless on the street. We see it there's lots of encampments all around Akron where I'm at. Cleveland's the same way. So, we're really have gone backwards in our approach as a society, because this is really, this is a national issue that the local communities are trying to solve. And, listening to the introduction, many of you are touching this population. You're seeing these individuals directly or indirectly. So what are we doing here in Akron? One of the things that we have is we have a pretty progressive homeless outreach program and team. So we have funding from a variety of different sources. So one is SAMHSA through PATH. So it's really what that part of this program is doing is they're doing street outreach. So we go out on a weekly basis to homeless encampments. We engage the individuals living there, try and find out what they need and develop a housing plan for them, bring them into services. These are typically people that are disengaged with society. So we're really trying to connect with them and help them meet their basic needs. So then we also have a transitional overnight shelter, but it's not a shelter like in our community, the Haven of Rest or Lakeside up in Cleveland. It's what we're doing is we're working with individuals that are being displaced. So when the city has to close down an encampment because it's on private property and there's complaints and what have you. So we go in and we create a housing plan for each individual living in that encampment. And then part of that plan is we bring them into the overnight shelter, and if they follow the program, they'll get housing within 30 days. And so we've been very, very successful with this. And it's really about target or housing focused shelter. And if you look at traditional homeless shelters, they're not housing focused. They're based upon providing that immediate need of shelter just to keep people safe. But it's ultimately, if you look at the data, shelters don't do a very good job of moving people into housing, and they often become almost warehouses, if you will, for people that are homeless. We also have a state opiate response outreach worker. So a SOAR worker is what we call them. And so this is someone that is really focused on the addiction issue. We see so much addiction on the street. We're very, very good at managing and addressing issues around mental health. But when it comes to addiction, it's much harder. It's much harder to do. It's much harder when they're in the throes of their addiction to break them out of that cycle. But we really operate from a harm reduction standpoint in that we know that there are millions and millions of people addicted to alcohol and drugs all across the country, and 99.9% of them are living in housing. And so there's no reason that anyone that we encounter that does have an addiction issue living in a tent or an encampment, that they can't be housed as well. And we also know that the likelihood of them addressing their addiction issue is much greater if they're living in an apartment as opposed to on the street. So our goal is to get them into housing and then use that as a stepping stone to getting them into treatment programs and what have you. If they're willing to go into a treatment program, that'll be our first step. But most individuals need a little bit more time for that. So then we also have a program that is addressing veterans. So the SSVF program. So we're in Summit County, we've done a really good job of addressing the homelessness in veterans. So we do have a housing resource for every homeless veteran. Doesn't mean that they're going to take it, doesn't mean that they're moving into it, but we do have enough housing for the number of veterans that are homeless. So, and this SSVF program is pretty key to that. Again, it's an outreach worker engaging with a homeless vet and developing that housing plan. We're able to provide some short-term rental assistance for them as well. So again, we're using these different programs that are community-based. So we're very aggressive about going into the community. We did that all through the pandemic. We never shut down. We had to change some things we were doing, but we continued to provide overnight shelter and all these services during the entire pandemic. So, which created a lot of challenges. But one of the things that we offer also is a drop-in center. So they're able to come in to our outreach center, and they're able to do laundry for free. They're able to get a cup of coffee. They're able to use the phone. They're able to use our address to get mail. And then while they're there, so they're there for their shower and their basic needs. Our goal is, again, to get them talking, to get that connection going with them, develop that rapport so that we can develop the housing plan. We can get them into the medical doctor. We can get them into the psychiatrist. Because again, we know what they really need is a long-acting injection, but what they want is a pair of dry socks. So we have to start with their need as opposed to what our goal is. We also have the Summit County Public Health coming in, and so we do a needle exchange. We provide fentanyl test strips. We provide Narcan, and we've had to Narcan a number of individuals on site. So we have to have some pretty strict parameters around using showers because you have all kinds of challenges around that. But it's a really, really valuable tool for meeting people where they're at. And then through Continuum of Care, which is a variety of different organizations that are all working towards addressing homelessness, there's a central intake. So every homeless program that is funded locally through the Continuum of Care or through HUD is being funneled through this central intake. So we're gathering data. So all that goes into a database so then we can start to see more trends. We can see repeat, people that are failing or it's not working out and they're going from program to program. So we're really able to start to develop customized approaches for the community on homeless issues. Just as when we have an individual client, we're often using that treatment plan or housing plan to really customize what the needs are. Just because they failed once doesn't mean that we're done or we're not going to try anymore. So this is just a picture of a typical camp. There's so much garbage at camps now, it's just unbelievable. There's lots of well-meaning community members going out providing goods and items, but the reality is they don't have a storage system for it. It gets wet, it gets ruined. They're given food, the raccoons take it. They don't have a refrigerator, right? So it's really become a big challenge around the trash. This is another local spot. This individual here that was staying here, right along a canal, was consistently blowing 4s on their blood alcohol level. And if you look at how close they are to the edge of the water there, it's just, scary. They roll over and they're that intoxicated and they're going to die. We ultimately did get this individual housed and he's doing pretty well. Another local spot underneath the bridge, you can see, in this spot, it's much different. Very, very clear of thought. They've placed pictures up. They've, made their bed. They're using cardboard as a rug. So, a lot of times when we go into these encampments, we can see kind of how their mind is functioning. So more often than not, we see a lot of chaos and dysfunction, or a lot of chaos and lack of systems, if you will, in how they're living. And it's just, again, piles of trash and what have you. So you can kind of see what's going on a little bit. Again, this was in Akron here. And so, I push back a lot against the formation of large encampments, and especially when they become sanctioned by communities and cities. It's basically us as a society saying that it's okay to live homeless, and we're going to just kind of accept that that's okay, and that there's really a lack of community outrage that we're allowing this to occur. Again, our problem in Akron is much smaller than it is in bigger communities, but in Akron, we actually do have enough shelter beds and what have you for the people that are living on the street. It becomes a lot of individuals are exercising their choice, and they do not want to follow the structure and rules that are put in place a lot of times. So those are big challenges. So this was, again, this was called Tent City. It was ultimately shut down by the city of Akron. There were a number of violent incidents that occurred at this location. And so we did develop housing plans for everyone that was living here. And I'm going to fall short on the numbers a little bit, but about 75% of the people we were able to get into housing. And then the other 25% either ended up ultimately getting incarcerated or just kind of disappearing. not following through. So, again, if sometimes it requires some pressure in order for individuals to not to want to get out of the homeless situation. So again, talking about the transitional overnight shelter. So like that tent city I just showed you, that's what we're using the overnight shelter for, is for places like that. So we had a camp that recently, there were 2 young females that were staying there. They had been branded. And so that's often when women are being trafficked, they'll be given tattoos or brands or different types of things because it marks kind of a product for the pimp. There was one person OD'd, one person died by train, and there was a rape also. And so, we see lots of negative events and incidents occurring. And so they end up becoming very trauma-ridden places, some of these camps, not all of them, but some of them. And so the city stepped in, forced it to be closed. Again, we offered the shelter to everyone there. And so the stats on the shelter is we've taken in 35 individuals who have utilized the shelter, and 22 of them have been housed. And these stats are a little bit old because we actually have another 10 individuals to add to that. So we're actually at 45 and 30 that have been housed. And then 10 went back to homeless, and 3 were transferred to other more appropriate programs. They were actually veterans. Veterans have a lot more resources available. So we often try to, make sure the VA system is stepping up and doing that. So again, not everyone that's homeless is going into this program. We're really using it for the hardest of the hard to house. So our goal is to really, really look at that group. Denver did a study where they looked at 250 individuals that were chronically homeless. And every year they were spending, as a city, $7 million on those 250 individuals by them being homeless. And so programs like this, while they are more expensive than other things, they're dramatically cheaper than jails and hospitals and what have you. And they really do work. But again, it requires that real push towards that housing focus on it. So everything we do is focused on getting them housed. It's not about solving all of their social challenges. They didn't get to where they're at overnight, and it's going to take a while probably to get them there. But again, we believe that by getting them into housing, it gives us a better chance at addressing their issues. So, so I talked about SOAR just a little bit earlier, but again, the goal is really to get people off the street into housing and ultimately into treatment, but at their pace. And so it's that harm reduction approach. People that have significant addiction issues, it often takes us years to get them till there's an opening where they're interested in some of the treatment options. And so we just have to be patient, with that. So it's a bit of a challenge. So when you look, every year we do a point in time, which is a count of the number of individuals that are living homeless. And so this is for Summit County. So if you look at all sheltered, so that would mean people that are homeless but are in temporary emergency shelters or a transitional type housing program or shelter type program. So you can see the numbers there from 2012 to 2021. We had a 52% decrease when you're looking at sheltered and unsheltered. To me, the unsheltered count is what's most important. The unsheltered count really represents an individual that has not been willing to engage with the community or society, and they want to be off for their own reason. Maybe it's because of their severe addiction, maybe it's their severe mental health, past traumas, but in general, what we find is they often don't want to follow the rules of programs and what have you. They want to live life on their terms. And so the decrease that we've seen there has been really impressive. And so if you look at 2018, there was a bump from 2017. That was that tent city. So that was kind of during the peak of that. And so we saw numbers go up dramatically. And again, by sanctioning or allowing homeless encampments that are large and structured like that, you're going to you're going to see increases in homeless numbers. So there are times when they are appropriate, and that would be if your community does not have enough shelter beds and or housing to absorb the number of people homeless. So, but again, so 52% decrease. So we know that by taking these targeted approaches, it really does work, and that we really can make significant impacts on the community. One of those impacts has been the development of permanent supportive housing. And so this is one of the projects, this is actually the first of 4 large scale projects that we did. So this is Commons at Madeline Park, which is a 60-unit apartment building. And on that campus, there's actually 2 of those buildings. So they have 120 units. 61 of them are for people that are homeless, 6 are for veterans. There's rental subsidy attached to all of those. And then we also have Stony Point Commons, which is 113 apartments, 8 units for chronically homeless veterans. Again, a very challenging population. 83 units are for homeless. Again, staffing on site. Psychiatrist comes in once a week for 4 hours a day. We bring a nurse on a regular basis, and we do have like doctor's office or clinic kind of set up. Case management is on site. We bring in vocational workers and what have you. Now, some things did change during the pandemic. Very challenging to manage that. The misnomer, though, it is that if you build amazing housing, you're going to fill it up, but it's not going to make all the problems of your individuals go away. And so you're still going to have a lot of hard work to do once people enter into housing. And there's a lot of challenges with it, but ultimately it does work. We've had over an 85% retention rate. So people that had been living, again, on the street in homeless encampments and move into permanent supportive housing. And you look a year and 2 years later, where 1 year we were like 87% people remain after 1 year, and we were around 80% for 2 years. So it is highly effective. If you went into a big encampment and said you could, 2 years later you could keep 8 out of 10 people housed, you'd be pretty excited about that. So there are other residential options though. So we also have residential treatment. So those are really kind of group homes. We have adult care facilities, which are group homes that are owned by the community, and more about long-term care. We also provide a number of tenant-based rental assistance. So not everyone's appropriate to live in those larger settings. Some people need a smaller setting. So we'll work with individual landlords and provide rent, and then the case management and wraparound services. There's also what's called rapid rehousing. So if you look at the number of people that become homeless every year doesn't really change. And about 80%, 80% of the people that become homeless are able to self-resolve. So we don't want to get in the way of people that, have something happen in their life, they become homeless, they get themselves out of homeless. We need to make sure we're focusing on those individuals that really need it. Rapid rehousing can be just what some people need, which is just a security deposit, month's rent, or that type of thing. Safe havens are for that. I think someone talked about the 5% of the hardest 5% of Medicaid populations. That's kind of what this type of housing is for. So it's people that have repeatedly failed other types of housing. And so it's smaller, but it's smaller in structure size, but there is staff there 24/7. So you have a much higher staff to client ratio. And then Section 8, which is AMHA, or the Housing Authority's housing choice voucher. It's a key component to all of our housing, and desperately need more of that as well. Many communities are in the decades for the waiting list for their Section 8. We're fortunate in Akron and Summit County that it's only a 2 to 3 year wait. But if you're homeless, that's still a very long time. And then the site-based BSH, which I talked about. And so then there's also large high rises around that are for seniors and or people that are disabled. All the ones in Summit County are more than 50% occupied by individuals that are disabled, typically mental health issues and what have you. And so there are also privately owned buildings like that as well, and they are rental based. So I talked fast, but I think I'm kind of on time.